Joining me today on the show, we've got Vikram and Philip and Rosie, different perspectives in the healthcare ecosystem, and we're talking about Consultmed's advice and guidance platform. Everyone, how are you going?
Good, thanks, Pete. Thanks for having us.
Great to have you on the show, and I'm excited because whenever we've got those different perspectives from the ecosystem, it results in a more robust discussion. When I say that, I mean, yes, from the technology provider's perspective, Vic, I know you've got a strong clinical background too, but also Phil from a clinical side, and Rosie from the consumer's perspective. So we're keen to harness this power of the collective to understand the capability of technology more. But Vic, it's been a while since we've had a chat on the podcast. We had you in the studio, I think around about 12 months ago or a little bit more. Tell me what you've been up to since the last time we spoke.
Yeah, so good to be back on the show, Pete. We've really spent the last year really building out our advice and guidance module and platform, building on some of our partnerships that we have as well. And Phil from DermScreen is obviously on the call today. We have been scaling the Consultmed system more generally across a few more hospitals and happy to announce some of those partnerships as well. So, a lot of work in terms of scaling the system, then also building on advice and guidance.
Yeah. And hey, Phil, it's we've had you on the podcast before too. It's and speaking specifically about the work you've been doing with DermScreen, but what's been keeping you busy the last 12 months or so?
Thanks, Pete, and thank you, Vic, for having me on the podcast today with Rosie. DermScreen's had a phenomenal 12 months with a completed pilot with one of the primary health networks and some funding agreements penned and potentially this really exciting partnership with Consultmed in advice and guidance, which I'm really looking forward to talking about in greater detail today.
Super. And Rosie, look, we were having a bit of a chat before we started recording, and I heard there's plenty of stories and experiences you've had within the healthcare system, but maybe as a high level and just some context too, and what brings you to this conversation. Tell me a little bit about the experiences you've had within the healthcare system.
Sure. Hi, and thanks for having me today. I am from New Zealand. I moved to Sydney 2 years ago. Relatively seamless transition, as you'd expect as a Kiwi, but the biggest hurdle was navigating the healthcare system. I have ADD and was diagnosed back in 2017, and I made the assumption that 1 month's supply of Ritalin and my documentation from my psychiatrist would be enough to get the drugs I needed over here. But 5 appointments later, 3 months later, $1,000 down, it took that long. And that's one of many examples I have where advice and guidance could have helped.
Interesting. Oh, that's awful. But I'm interested to speak with everyone on this conversation about that tie-in with how we can address some of those issues, like how these things come about and where that problem is and how something like technology can help address it. So tying back to Vic for a second here, the advice and guidance we've touched on a couple of times already in this conversation. Vikram, tell me a little bit more about what it is and how it ties in with the rest of Consultmed and the problem itself.
Yeah, so the advice and guidance concept, probably kind of really championed by the NHS, is a really innovative model of care that basically aims to improve access to specialist services, particularly in rural, regional, underserved areas who don't have that specialist workforce. And often it's from primary care using technology to ask specialists for their opinion. And the whole idea is that, particularly in Australia, you need a referral to access specialist services. And that's what often contributes to significant outpatient wait times and waiting for that specialist care, particularly when you're being referred from primary care to say, the public hospital system. What advice and guidance does is when you implement technology, so secure technology that allows primary care providers to message specialists, whether that's asynchronous messaging or synchronous messaging, it means that primary care providers can ask specialists for their opinion about how to manage patients and ideally manage patients in the community and prevent the unnecessary hospital visit and prevent that referral happening in the first place. And so we know very well documented, very well evidence-based, at least 30% of presentations and referrals can be prevented if you are able to implement that technology and implement that advice and guidance model of care. So that's what we have built on top of our Consultmed referral system. And so anyone using the Consultmed system can actually request for specialist advice. And we know that specialists like it as well. So I'm a pediatrician, pediatric respiratory physician. So I only want to, particularly see patients that are complex and require specialist care, knowing that my GP colleagues at primary care providers are very adept at looking after patients in the community. And sometimes they just require that extra specialist backing in order to continue managing patients in the community.
That's an interesting one, isn't it? Because, this point around reducing unnecessary referrals into the specialist system, because, as you clearly articulated, that's how the Australian healthcare system works. If you're going to speak to a specialist, you've got to go through a GP. But then there are other parts of healthcare, say in the allied health side. If you said, preventing referrals into allied healthcare providers, it's kind of like, well, they would see as many as they can, because that's their business, and that there's not that the strain and the requirements. A different kind of challenge to face, and some other healthcare providers really want to see as many patients as they can. And so you're saying in the specialist side, that's addressing those kind of key issues, which Rosie almost, in a high-level intro kind of pointed out in the first place, is that the specialists have got the long wait times, and it's not an issue of, it's not like they don't have the demand, but so that means that they want to make sure they've got the right patients coming to them to be able to give the best quality care. Am I on the right path here, Vic?
Yeah, well, so this concept, the advice and guidance model, fits really nicely to those allied health and other healthcare professional models as well. So as we know in Australia, elsewhere, everyone's scope of practice is increasing, pharmacists prescribing, allied health providers, nurse practitioners. And so this model, again, really strengthens primary care and strengthens other healthcare providers practicing, because they can then use this to access further specialist opinion when needed. So it's the, musculoskeletal physiotherapist asking for specialist advice from the orthopedic surgeon. It's a pharmacist who might be in the community prescribing, asking for specialist advice back from the GP or from other specialists. It's the midwife in the community asking for advice from the obstetrician. So again, you can see how that model of care enables all healthcare providers to work at the top of their scope, and also prevents, again, those unnecessary hospital visits where possible.
Yeah, and I guess, Rosie, from your perspective, in trying to navigate the healthcare system, and as a new healthcare system coming across from New Zealand, I guess in the end, you've got a particular goal in mind. You've got that timeline, as you mentioned, with the medication that's set for a period of time. Talk to me more about that experiences with the healthcare system and how you kind of came across those struggles and, just felt like, because sometimes just like, well, why can't we just do it this way? Like, this makes so much more sense. Why don't we just do this? Tell me more.
Yeah, no, it was a very frustrating and distressing time where it really shouldn't have been. I saw my GP once I arrived, and soon learned that she would then need to refer me to a psychiatrist. It was post-COVID, so she warned that wait times would be a while to get in. So I had a general referral, and I started to contact practices of my own accord and heard nothing back. And it was only through a friend who knew a psych in Melbourne who managed to get me a Zoom appointment maybe 6 weeks later. I spoke with this psychiatrist. She was great, but we had to start right back at the beginning of all, it didn't matter. I had the documentation, it didn't matter. I'd been prescribed before. Start again from scratch. And then she would then apply to the government to get the authority that she could then send back to my GP and my GP only. And she didn't know, she was a bit skeptical that because she was in Vic and I was in New South Wales, was it even going to work? But she said, go back to your GP in 3 weeks. You should have my authority letter to your GP so she can then authorise your Ritalin going from there. I went into the GP practice, sat in her room. I said, yep, she's sent you my referral. And she said, we haven't received anything. And I said, maybe just check your emails. She said it was on this date. And she said, email? No, we use fax. Yeah. And I didn't know that technology existed. I've never actually seen a fax machine. So So I had to leave her office, call the psychiatrist, get them to fax it again. I asked if I could have a copy of that by email, not possible. And so then, this is another full paid visit back to the GP, and then for her to prescribe me Ritalin. And then she went on maternity leave and moved to Europe. And so I then had to start the process again.
Oh, no.
So it was just, pretty insane. And so, and there are other examples as well. Let me know if you want to hear them.
Yeah, probably. Yeah, no, I'm sure they may come out in the scope of the conversation. I'm reflecting on as you were sharing that. That's so many people would resonate with that story because we've all probably experienced some kind of frustration with the steps you need to go through in the healthcare system, not through any fault of any one particular person, but I just think that the way the whole thing is built and the resources that we've got available to us in some parts, like the fax machines, as you say, or the silos of information, it's not like it's necessarily life and death at that particular point in time for you. And it's like, oh, well, that's mildly annoying. I need to go back, and it's a lot of time on your side. And as an individual use case, you're like, okay, well, I can deal with that. But I'm just picturing that at scale, across the healthcare system in Australia. There's so much of this unnecessary faffing around that we do within healthcare that if we actually had a bit more of a structured approach to addressing it, in the end, it means that you haven't got nurses and doctors and admin staff running around trying to clean things up. If we can have that better structure, that makes so much. And in the end, patients can just get what they need and get out of, get out of the way from the other patients that want to come and receive care. And that's what patients want to do. I don't think people want to stay in the system unnecessarily. So back to Vic for a second, and in terms of, advice and guidance and hearing some of Rosie's experiences, how are you kind of picturing, the module to really kind of have an impact in some of these situations?
Yeah, so mental health's a really, obviously, a really growing space and one that needs new solutions, with again a shortage of psychiatrists and psychologists as well. And so in Rosie's situation, an advice and guidance model sits so nicely. So she's already had a psychiatrist prescribe, and this is an Australia-New Zealand college, so it's completely relevant here as well. And so on seeing a GP, the GP is able to use the technology to ask if they're concerned about prescribing or unsure, etc., are able to ask the psychiatrist directly, in this case, about what medications to prescribe, for instance, dosing, those types of things. Now, obviously, in this case, there are some government regulations around ADHD prescribing, but I mean, more generally, in terms of any uncertainty around prescribing or how to manage a patient or any of those things that GPs do really well, but sometimes require specialist advice, that's a really good example here. In this case, again, being able to use technology like advice and guidance to actually contact Rosie's psychiatrist in New Zealand, confirm the prescription, confirm the management plan, and then enact it, would have prevented 3 months of waiting and multiple visits and $1,000 of specialist visits and all of those things. So I think mental health, obviously, but basically the system works really well in any high volume specialty service, dermatology, ENT, musculoskeletal, cancer services, anywhere where there's often just those tertiary centres, and often they're only in metropolitan centres. So if you're a GP practicing in regional, remote Australia and you need access to specialist services, rather than just, referring and then the patient travels and waits 3 or 6 months, this is one of those models of care that works really well.
No, I hear you. And, Phil, in the dermatology space, and we know as well in your practice, you're always looking at utilising, technology or innovative ways to address issues, because as a derm, I can only imagine, I know the wait times are long. I had to pay a couple $100 to get to carve out this time for this podcast episode because you're so busy. I'm joking. But the fact of the matter is there's many dermatologists and specialists out there that would love to be able to see more patients, but just don't have the capacity. These conversations that Rosie and Vic have been sharing, is this kind of resonating with you? And can you see the application in terms of how you're doing things at DermScreen?
Completely, and that's how not only as a practicing dermatologist, but also very interested in technology, founded DermScreen a few years ago, simply to bring together clinical services to the 21st century. I think if you apply technology to a lot of dermatology workflows, and we'll go into what that means from the partnership between DermScreen and Consultmed, it can really be a game changer. And dermatology is quite unique, and I'm sure Vic will explain further, but we actually make a lot of diagnoses based on a clinical image. And in fact, a lot of information can be gathered from short and specific clinical bits of information in conjunction with a high quality photo. And that might allow primary care providers to seek advice and guidance from a dermatologist like myself to be able to care for that patient within that community without having to travel hundreds of kilometers, for example, for our rural patients, in order to receive specialist care and advice. I think with general practitioners being our frontline healthcare workforce, they do demand support from specialists. And I think through advice and guidance, they're able to receive it. And this is where this platform can really be a true innovative solution to the fragmented care within our Australian healthcare system.
Yeah, look, it's that makes a lot of sense to me, and keen to, I guess, understand some of those practical examples of the partnership. And I think at some point you touched on, the integration in with the PHNs and supporting the GPs in that respect. Walk me through how some of that's going to work and the impact that has.
Advice and guidance has two functions. For the patient, they can receive specialist care quickly, sometimes within 24 hours, and we've been able to get a response back to our GPs using our various technologies within 23.5 hours. That's our average mean response times. But more importantly, there's an educational component to advice and guidance as well. So GPs are not only receiving specialist advice in a timely manner, almost real time, but separately, they're able to learn from the patients that they are looking after. Often than not, when patients are referred to a specialist, the GP loses contact and hence being able to learn from that care. As specialists, we learn from all our patients, and I don't see why GPs are any different. And if they can actually walk through that journey with that patient through the support provided by a specialist dermatologist, for example, they can in future actually apply that learning to their future patients. So much so that DermScreen is actually working with education partners to work on GPs to be able to obtain CPD points as a result of submitting cases through the advice and guidance platform.
Oh, interesting. Yeah, you've even got that closing the loop there for the ongoing learning piece too. So that's cool. And Vic, it's exciting to hear how, this is a great use case for dermatology for advice and guidance, but it goes much more than just enabling dermatologists and GPs to speak to each other, right? This is a whole new capability.
It is, yeah. And I think it's definitely one that is being explored much more in the Australian healthcare system. There's been some good research coming out of Queensland Health as to how advice and guidance or e-consult works and how it can prevent unnecessary hospital presentations, how it can reduce wait times as well, which is obviously a key thing that we're all looking to do. And the education piece, just touching on what Phil said, is one of the key reasons as well that we really wanted to partner with DermScreen, because again, like the advice, intuitively we know goes back to primary care. They, primary care providers understand what that specialist advice is for the first patient. So then subsequent patients, obviously they're better informed as to how to manage the patient. But again, adding this CPD element to it is really interesting, and what Phil's doing in terms of actually making these pieces of specialist advice actually continuous professional development. I think the other part of it as well is it's not all preventing hospital presentations. The advice and guidance can actually be used when you're accepting the referral as well. So generally what happens at the moment, as Rosie experienced, the referral's made, and then if they receive it, in this case via fax or email, on the other side, it's very labor intensive to try to fax advice back, right? People don't do that. So then they just book the appointment in. And so there's this kind of dead time for 3 to 6 months while you're waiting for that specialist appointment. In that time, or if you're put on a wait list, your chronic condition can start to get worse, right? You might have new symptoms. There's a risk that hospitals hold as the patients are on their wait list waiting for the specialist appointment. In this case, where we've implemented Consultmed, both the referral and the advice and guidance system within the hospitals, the specialists actually accept the referral as well, but then provide advice and say, look, dear GP, we've accepted the referral. We're going to be seeing the patient in 3 months, 6 months, etc. In the meantime, this is what you need to do. Please order these tests or start the patient on this or order these investigations. So by the time the patient comes in for the appointment, all of those initial investigations have actually started. That early management plan has started. And so then that first appointment is a lot more useful and a lot more informed as well. And what we know from the evidence is that by having that first useful appointment, it also reduces the number of follow-up appointments as well, because then things have started, you've implemented the management plan, and therefore you're quicker to discharging the patient back into the community as well. So it benefits, obviously, patients. They're accessing the specialist opinion much more quickly. It strengthens primary care, GPs get access, and then specialists in the hospital system as well, they're seeing more patients and getting more patients off the waiting list.
Well, that ties back to what Rosie kind of mentioned too, which was the needing to start all over again in a consult, because that's the worst, isn't it, Rosie, where you've already shared a lot of information and you then it's like, okay, well, tell me why you're here. It's like, okay, then you got to kind of start again from scratch. I don't know if I'm opening a can of worms, but tell me more about some of those experiences, because you mentioned as well, there's probably more that you could share, but does this kind of stuff resonate with you or look like it would potentially address some of those issues you faced before?
Yeah, definitely. Like Vic said, if the first appointment, if you had access to specialists, it would have reduced all that dead time. And because I had to wait so long, the consequences of the stress of the money, the time, and not being on the medication, that I ended up having, getting diagnosed with depression to manage my anxiety. So that had all these follow-on effects. And then this year, I felt like I was got into my groove and really felt like I'd come off antidepressants. And so I went and saw a new GP, and I said, what's the best way for me to wean off X amount of this? And he said he just couldn't give me that advice and he would need to refer me to a psych. So I got, again, a general referral, which never got picked up or answered. So I just Googled it, and now I'm off my medication. So just stuff like that, just really simple. If there'd been access to a specialist within the GP appointment, this saves so much time. And then also another consequence of the time it took. Back when I first moved here, I had back pain before, but it presented super chronic, slightly different spot. So, very distressed speaking to that same GP. She sent me off for x-rays, even though I knew it was probably going to be an MRI that she needed. Came back for the follow-up appointment. She told me what was wrong. She was quite stressed out by looking at my x-rays, and because I was in a lot of pain, she actually contemplated maybe I should just go to the ED, try to see an orthopedic surgeon that way to get noticed. And then she changed her mind in that consult and was like, actually, no, we will fax a referral to the Prince of Wales Hospital. And once again, I was at the mercy of that technology, and it was never picked up and I was never called, which was all very distressing and expensive. I ended up seeing a hip specialist just myself, just contacted them, dropped $500 to see him, dropped another $500 for the MRI, and just nothing came of it.
It's awful.
Yeah, so quite a bit there.
I mean, that highlights so many things within the healthcare system that sometimes, when you're working within it, you kind of you look at it through a different lens. So often we've talked about, and you hear sessions on, and the sentiment is, those silly patients that Google stuff because because they don't do the right thing. They should just go speak to a GP because the GP is the trusted person. And do what they're supposed to do. It's like, we're trying. Hey, like, you know, there's something wrong inherently with the system that means that patients still need healthcare to be delivered, and that, like any normal person would do, if it's not working, then they're going to find alternative ways to get the information they need, or the whatever's required, and sometimes that means then taking matters into their own hands. So I think as a healthcare system, if we're really serious about like investing in the capability and the education and the safety and the structure and everything that we talk about, how it's so pristine, and it is very good, but then there's these parts that just let it all fall apart by the wayside. So if we, you know, by strengthening some of this, I can see that has a much more measurable impact, much more than just the reducing, like all those other important points around reducing cognitive overload and the cost on the system. The result for patients is huge. So Vic, back to you as we kind of reflect on a lot of that. Then there's a lot of potential, a lot of work to do. Like, what can we look forward to seeing from Consultmed and advice and guidance, and where your priorities are, and where might we see this come up most often? You touched on a few particular disciplines, but where are your priorities at as we move forward?
Yeah, thanks, Pete. So in the next few weeks, we'll be releasing our white paper on advice and guidance and how it's specifically tailored to the Australian healthcare market, what we're doing, but also the evidence behind it as well, locally and nationally. So stay tuned for that. That's definitely coming out. And also, you'll also see some of our rollouts happening, firstly, obviously with DermScreen and with Phil, and that work is really exciting. And yeah, hopefully a few more announcements and a few more partnerships to come this year. So yeah, lots of work, but really excited to see this model of care gain traction, and people kind of, I think, intuitively straight away understand the concept, because it fits in our normal clinical workflows, but really, you know, working with local hospital districts and PHNs and getting it deployed and getting it into action.
Yeah, absolutely. That makes a lot of sense. And Phil, while I've got you here, you know, as one of those kind of key initiatives to demonstrate the capability, particularly in the dermatology side, what's exciting you about this strong partnership with Consultmed and DermScreen in the coming months?
Well, it's allowed us to launch our provider-to-provider advice and guidance service, and we called that Derm Assist by DermScreen. So the idea is that, modelled off our experience with some of our earlier partners and in primary health networks and rural GPs, we've been able to hopefully demonstrate a reduction in the number of biopsies that GPs need to make to investigate a suspicious lesion. But more so, during, for example, if I might share the results of our recent pilot with Western New South Wales Primary Health Network, was the fact that during the course of half a year, we've been able to show an increased concordance. So what do I mean by concordance? It means that the diagnosis of the GP and the dermatologist as being matched. So there was an increased agreement between the opinion of the GP and the dermatologist over the course of the pilot. And that really demonstrates to me that GPs were learning as a result of referring to the platform. And that's really exciting to see. And that was initially done on lesions of concern. But through our partnership with Consultmed, we've actually built out other offerings that involve facial rashes, whole body rashes, skin conditions involving hair and nails, because dermatologists also are involved in those conditions as well as acne being a huge problem here in Australia. And I'm thinking about Rosie's particular problem, you know, a psychiatrist requiring to give the authority to a GP to prescribe Ritalin. I do challenge my colleagues, you know, would we be in a situation whereby dermatologists could give GPs that level of advice and guidance, as well as support to prescribe isotretinoin in the context of severe nodular cystic acne? It would be something that I think would improve access to specialist care and medicines that are at the moment exclusive to specialist dermatologists. Wouldn't that be an amazing thing to achieve through a technology platform?
Great example, and it certainly does, pose that question and help people kind of understand the real application and potential of it. So exciting to watch with interest, Phil, as the capability rolls out further. I want to close on Rosie, though, because often we talk about healthcare on the Talking HealthTech podcast and often forget to focus too much from the patient perspective or maybe gloss over it too. But to give Rosie kind of the final thoughts or reflections, or at least just from your side in terms of, like, if this was done well, what would that process kind of look like for you? Or what does better to improve the experience for a patient? Like what would need to happen within healthcare to make it a good one for you?
The expectation that you should be able to see your GP. You don't expect them to know everything. They're not a dermatologist, they're not an orthopedic surgeon, they're not a psychiatrist, but they should be able to, in a dream world, in real time, have to get 5 minutes time with that specialist and make that first appointment as valuable as possible and get as far ahead on your treatment plan as possible. So actually get your $120 worth for 15 minutes instead of literally walking in with a piece of paper that's going to do nothing for you. And Vic and I have touched on this before, but I speak English well. My parents are doctors. I can navigate the health system. I'm confident talking about my story, even if it's a drain to start again from scratch. But it would be an absolute nightmare if you weren't as privileged as where I was standing. So, all of my problems are, minuscule in the scheme of things, but they all added up and they all had consequences on each other. So just getting that first appointment right with the GP, I think, has a really amazing flow-on effect.
Yeah, and I think the first word you said was expectations too, and that's something that sometimes there's such a misalignment within healthcare where it all kind of falls down from there too, and there's a lot to kind of build on to make that realistic. But I did find it funny too that we do this all the time. We laugh and say, the dream would be for this situation, and what you outlined doesn't sound too unrealistic, to be honest. But in healthcare, it sounds like it's a fair bit of work, but it's just the reality of getting the most out of the time initially that you have with a patient, that first consult, to be able to then get your care pathway off and racing as efficiently as possible. And that, I think, is a fair expectation that any patient should have. So it's exciting to be in this conversation where we get to unpack a little bit about how that might happen. And Vic, Phil, Rosie, I appreciate you making the time to have a conversation, talk about advice and guidance. Looking forward to seeing how it all progresses. Thank you so much.
Thank you.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.